While most Nigerians seem to be moving on after the COVID-19 lockdown, government is urged to adopt new communication approaches and ensure equitable distribution of palliatives in rural communities in the event of other health emergencies. The Lagos Urban Studies Group, in partnership with the Nigerian Slum Informal Settlement Federation, came up with these in a report on how the COVID-19 pandemic impacted on lives and livelihood in slums across Lagos.
Following weeks and months of engagement in various slum communities, the Lagos Urban Studies Group, an interdisciplinary research team comprising of those in the academia, civil society organizations and government actors, has challenged the government's response to the COVID-19 pandemic, questioning the risk communication approach, investments in basic health facilities, and distribution of relief materials in hard-to-reach communities during the 2020 lockdown. The study seeks to ascertain the socio-economic conditions, health behavior of slum dwellers, and how the dearth of basic amenities informed the propagation of various conspiracy theories in rural communities.
So essentially, we wanted to know these people, where they live, their condition, and how their situation could intensify the impact of COVID-19.
We have found out that there was poor knowledge of COVID-19. They saw it like any other disease. And so if there was a major outbreak, we would have had real crisis to deal with, health crisis in this community.
Findings from the study reveal that people who live in slums do not have access to decent and quality housing and generally cannot access basic services such as water and sanitation, indicating 61.5% rely on trucks and water carriers and vendors.
At the time of this COVID-19, the government did not attend to us at all. During this time around, if they see fit, they can assist those of us. We are ready to accept that.
In one of the communities under review, portable water is a mirage. On a trip around the Ajegunle community, you see that water is gold. Tanks and containers are on the lock and key.
We have been begging them to connect us from that water from my 12 here to this community. But no.
We have only one road in this Ajegunle. That's Zion Street. Only that. After that one, people are suffering.
While the stakeholders are appreciative of government intervention, the decades-long challenges still persist.
There should be synergy in planning between government and the people, and they should train the people so that they know how to communicate the real issues, how to communicate the symptoms of COVID. And this is very critical anytime there are emergencies and disasters.
The popularity of the word coronavirus may have dwindled in slum communities and urban centers. The pandemic has, however, exposed the dearth of basic amenities in these slum communities, one of which is access to portable water. These communities are hoping that the government of the day will see to their need and provide one major thing, which is wash facilities. Sarah Yeku, TVC News, Lagos.